Hello and welcome. You're listening to the SPAG Dialogue podcast. In this episode, we have two healthcare communications professionals talk about India's immunization roadblock, how to beat vaccine hesitancy through equitable access. Aman Gupta, co-founder SPAG, in conversation with Mark Chataway, co-founder Baird CMC.
Hello everyone, my name is Aman Gupta and with me I have Mark Chataway, co-founder of Baird CMC, one of the leading experts in healthcare and health comms across the world. Someone who I have known for more than 20 years now, and I really do look up to him when it comes to this subject. I think what we're going to discuss today is really very, very relevant, something which is touching all of our lives, is the pandemic COVID and the need for vaccination. And especially in India, population 1.3 billion people gets vaccinated. Of course, there is a task from the logistics side of it. There's a task from the vaccine and its availability part. But apart from that, there is also the need to understand how do you really get people convinced, because we do know that there are groups or individuals who have a certain kind of hesitancy about going for the vaccination. There is a larger population which cuts across the huge geographical span of what we know in India, not just from geography, but from the language, from the health literacy side of it. So how do we really sort of ensure that happens? Because if we do not, the pandemic will remain, and it will remain a huge health issue, not just for India, but for the rest of the world. So we are hoping that today in this particular conversation, we will be able to find some insights, some thoughts, and some actionables, which could be useful for various people who are engaged in really bringing the world to the new normal, as we call it now. With that, welcome, Mark. Let's start with understanding your point of view on what you think it will take to make the Indian population gets vaccinated.
I think there are really sort of three levels, and I don't think COVID is that different from other vaccines. I think in what you said at the beginning, you hit the most important of those levels, which is logistics and making it easy. So what we know from flu vaccination is that if you make it difficult, very few, and this is not an issue in India because sadly India deploys very few flu vaccines. But what we know from flu vaccination in North America and Europe is that if you make it difficult and complicated, your coverage rates are low. If you make it easy, your coverage rates can easily get to 70, 80% of the target population. So, to me, 90% of our attention should be focused on making it easy, on having systems that fit people's lives. People can work 10 hours a day, look after their family, do what they have to do and still get vaccinated. It's not go and stand in a queue for 12 hours or pay someone to go and stand in a queue for 12 hours. So to me, that's where 90% of the attention is focused. And if you get that right, you'll probably immunize 90% of the population. Tier 2 then is dealing with people who are a bit reluctant, a bit hesitant, as the terminology has it. And to me, the easy way to what the literature shows us is that engaging with those people in argument doesn't do any good. It funds people like us because we work for communications agencies, right? So it's good for business, but it doesn't have an effect. What has an effect is nudging them into it. So you say to them, okay, you don't have to get vaccinated, but if you want to go back to the gym, if you want to go to a crowded market, if you want to get onto an aeroplane, if you want to get onto a bus, if you want to get onto a train, unfortunately, you're going to need to show proof of immunization. At which point you're up to 98% coverage, probably, if you've done that right. And then you're left with the 2% who really have a problem. And there is a hardcore of, I don't know what it is, 2, 3, 4%. And it depends whether troublemaking populist politicians have been winding them up or not. But it's a small hardcore who really have a problem with vaccines. And for that group, you use different techniques. But I think all the discussion and the discourse gets it in the wrong order. We spend our whole time talking about this 2 or 3% are convinced followers of Ayurveda or think the pharmaceutical industry is a plot by Bill Gates to microchip the world or whatever. They're tiny. We should focus, nearly all our attention on the first two.
Right, Mark. And I think, just to sort of extend the 2 points and sort of try to get an understanding of where we stand in India right now, if we therefore look at the current way the people are getting access to the vaccine, which I think is even difficult for people like us in the metros, where you have to, one, ensure that you have a kind of a laptop or a kind of a computer system for you to log into something. You need to know how you need to do. You need to have a mobile phone so that you can get an SMS, you log in, and then after that you need to sort of spend hours together to sort of get a possible slot, per se. So definitely that defeats the purpose one itself, because it does get so difficult. And especially therefore the whole divide which happens, the whole equity part which we talk about, the urban population versus the people in the peri-urban, rural, or even the rural dark areas will not, get access to that. So are there examples from other parts of the world where certain governments might have done something differently? Because I think in this case, the idea was that we do need to know who is getting vaccinated. How do you ensure they get the certification? There has to be a certain mechanism to, keep the supply and getting, people who are sort of getting it. So hopefully it will ease out in the coming months, as we know that the government has said that they will get 100% of the population vaccinated by the December 31st, 2021, a huge task which they have committed to. But how does the Indian government do now in terms of they need to really sort of make the things easier?
I agree with you. I suppose there are a few models, but I'm not sure any country's got it completely right. I notice here in Ireland, for example, what happens is you get a text message, usually about 48 hours before the appointment, that says your appointment's at 9 a.m., you're going to receive a Pfizer vaccine, and you have to go to this place. The only thing you can do is reply new, which means I can't make this appointment. And then you have to wait a couple of weeks and you get another random appointment slot. And so the argument people have made here is it'd be much better to reply, I can't do appointments at 9 a.m. because I work night shifts and my shift finishes at 9:30, or I don't want the Pfizer vaccine, I want Johnson & Johnson. So it's very difficult to point to countries that have got it completely right. But the guiding principle should be to have multiple routes to get the vaccine, which, as you say, are accessible. Some are accessible to people who are super tech friendly. So multiple routes to make the booking. I think where it's possible, give people a choice of vaccines if you can feasibly do it. But in India, that's probably not feasible at the moment. Then we should look at what the experience is. That's the first two things to do. That gets us to our 70, 80%. And then I think the people who need to be nudged into it, India should then think about following the example of Israel, which has worked really well, of saying, we're not compelling you to have a vaccine. If you need to go and buy food, you need to go and do the basics of life, you don't need a vaccine. But to do the stuff that's high risk, to go and watch a cricket match, to go to the gym, to get on the train, you need a vaccine.
Kind of embed that as a part of the, the Aragya Setu app, which we may have, which sort of says, okay, your status of vaccination, and that only will help you get access to certain public gatherings or certain other places, which is, high with the population.
And it doesn't have to be a foolproof system, because so long as 90% of people are playing by the rules, it doesn't matter if a few slip through, because what you're looking for is this sort of a much abused term, but what you're looking for is a kind of mini herd immunity, right? A herd immunity within the people sitting watching the cricket match. Certainly India should be thinking about that. And the European Union is now introducing what's called a green passport. It's going to have a QR code in it. You'll be able to print it out, but it'll be on your phone, which is where most people will use it. And it'll be something that scans back to a central database. India, as you pointed out, Aman, absolutely has the capacity to do this. We know this from multiple recent examples. So India should be thinking about how to implement that in a way that isn't intrusive on privacy. So the EU's gone to great lengths to make sure this can't be turned into a tracking device to track where dissidents have been going. So the EU's gone to great lengths to make sure that it can be used for the purpose it's meant for, but it can't be used for any other purpose. And I think there might be stuff India could take from that, from the example in Israel, from countries like Malaysia, which have also been thinking about it.
What do you think, Mark, about the role of, going kind of a more local, because we do know that, each community in itself has its own thinking about, the vaccination or public health issues. What about the role of, certain civil society organizations? Because I've always been fascinated with the role which they play, because they are so close to the, to the community per se. They have the pulse of the local population. They are someone who people sort of trust. So do you think it makes sense for really the state governments to work closely with? So it should not be something which becomes like while the sourcing can be, or procurement could be central, but its accessibility could be sort of worked through kind of a huge civil society which does exist in India. And then I don't want to sort of come to the role of communication, which is not just about reducing hesitancy, but also about the other challenges which exist in today's world.
It's an interesting question, isn't it? I saw the head of the CII last week saying process of allocating vaccines in India had just become too complicated, that there's a quota for the central government, there's a quota for the states, there's a quota for the private sector. It's difficult for employers, it's difficult for industry, it should all be simplified. And I think there's a lot in what he was saying. So he was saying central government should take responsibility for 80% of the vaccine stock. And there should be a transparent, and I think the courts have almost imposed a transparent mechanism, right, as I understand it, but there should be a transparent mechanism for allocation. And within that, could you allocate some to civil society groups who had the capacity to vaccinate? I think you could. I'm not sure you want to start having a whole separate parallel supply system.
Fair enough.
I think that works in countries in Africa, but India has a much more sophisticated distribution infrastructure. I thought that what he was saying had a lot to be said for it, because accountability follows, right? If you say central government is getting 80% of the stock, it has the mandate to distribute it. The courts have said it has to be distributed in an equitable manner to reach the populations. Then there's a clear responsibility. So I think it was, sorry, that was a long answer to the question, but I think if there is a role for civil society, it should be integrated into some kind of public sector delivery system. And then the private sector, I think there's a big role for workplace-based programs as well as hospital-based programs. So clearly there are lots of companies who are going to want to immunize workers and their families.
Yeah, and I think that's happening. We can see, for example, one of the largest food distribution company, Zomato, they were able to get all their frontline delivery boys, vaccinated at one go. And I think does sound that the private sector is playing and can play a critical role, because they are the people who are really not at the forefront. They're the ones who are out in the public domain, but the corporate took upon itself. And of course, we've seen groups like Tata's and others who have not just looked upon, the employee population and the family, but also the communities in which they operate. So I think such kind of a large conglomerates who have always been at the forefront could play a critical role here.
And actually, if I may, Aman, I think that also, remember I said we don't need to devote much of our attention to hesitancy and reluctance and refusal. But actually, hesitancy disappears when people you live around and work with have had the vaccine. And so I saw this happening in the small village we live in, that there were people who were going, oh, I don't know, I've heard about blood clots, I'm not sure, whatever. And then as half and then 70% of the village got immunized, you stopped hearing that, because they looked around them and they saw, well, my friend's okay, my neighbor's okay, my husband's friend's okay, I think I'll be okay too. And so in workplaces, that's clearly a very powerful way of it happening, that if you've got a Tata site employing 10,000 people, and they look around and they see that 8,000 of them have been immunized, the remaining 2,000 are highly likely to be immunized.
I agree with you. And I think, Mark, so I think just want to sort of shift the gear, and I think it's almost kind of, the end. We have discussed the fact that the logistics and ease of getting access to the vaccine plays a critical role. There are kind of more of a nudge strategy, not really a heavy, aggressive comm strategy, which would work to get the people to sort of, look around and say, let me just get it done, make it, showcase certain benefits of getting it. So, benefits becomes higher compared to the the fact that they will not get it done. But last, in terms of, there are this larger conversations happening in the communication circles, especially in the public health, about rumors, misinformations, which becoming bigger and bigger, especially in countries like India, where more and more people are using social media, open social media like a Twitter or Facebook, or even closed community groups like a WhatsApp or other messaging apps, which are present across not just the smartphones, but the huge feature phones population, which we have, covering almost whole of the India's population. And there you sort of see things floating around. And we have seen where people say, oh, certain deaths happen. And over a period of time, when they start to just gain more traction, it could become a larger population to say, I have heard it and I believe in it, right? So irrespective of what's happening around me, I start to believe. So doesn't the kind of, so while at one go, while it might be okay to go with the strategy, over a period of time, keeping in mind that such rumors and misinformation can create a certain kind of a mindset amongst a growing population, the need for communication and sort of reducing such kind of rumors, building kind of a trust, is something which is a kind of an important track which needs to be done.
I think we have to look and be absolutely sure that these rumors are gaining traction, and I'm not at all convinced they are. What we've actually seen in most countries is, as the vaccine rollout progresses, distrust of vaccines drops dramatically. So we've seen that in Western Europe, we've seen it in North America, we've even seen it among minority populations. So, we had a big problem in parts of Western Europe among South Asian populations, especially Muslim communities, but not exclusively. And then as the mosques, as the imams became involved, as they saw their neighbors getting immunized, it kind of disappeared. And so I think we have to be really sure. But there are examples. You're right, Aman. If you look at HPV in India, and you look at the tragic history of HPV, right, where, 80,000 Indian women a year die of cervical cancer, the vaccines could prevent 95% of those deaths. So vaccinating girls today means that in 15, 20 years time, instead of 80,000 deaths a year, there would be 4,000, maybe fewer. And we'd save lots of people from head and neck cancer, and it goes on and on, right? And yet we can't, it's been 12 years now.
12 years,
Vaccines still, what do we have? A few pilot projects in Punjab, Delhi, that's it. And a lot of that is the result of deliberate mischief making by people for their own political and commercial ends. So is there a risk of that happening with COVID? Yeah, I guess there is, and we have to be careful. I think the strategy we know for overcoming it is to damp down the discussion. So we have that really interesting pilot in Haryana, I think, where people could get answered by text message to questions they had, and the answer came from a nurse, if I remember the pilot correctly, and it worked really well for childhood immunization. So yes, if people really have questions, if they genuinely, want a bit of reassurance from a nurse or a doctor to say, is it safe for me? I think absolutely we provide that. Overall, though, the message is to say, look, these vaccines are completely normal. These vaccines are completely safe.
Sounds good, Mark. And again, as I said, I personally do believe that comms has a role. What's the extent of it and what level it needs to be done sort of changes from issue to issue, geography to geography. But it needs to be part of the thought process from the beginning and not something which organizations sort of should bring in as an afterthought. And and I think hopefully we will get Indian population vaccinated.
I think the role of comms is positive, though. It's to say, look at these success stories. Look at communities going back to normal. Look at communities where there have been no deaths. Look at sports clubs reopening. And it's that message that we want to get across, not engaging with the crazy claims about Bill Gates's microchips.
Fair enough. And I think with that positive note, we can come to this end. Thanks a lot, Mark. It was amazing having this conversation with you. And I think I definitely learned a few additional things today.
Thank you for listening. If you'd like to tune in to more such conversations, subscribe to the SPAG Dialogue podcast or visit our website spagdialogue.com.